Good afternoon and welcome to today's teleconferencing session for students of Diploma in Nursing Administration. We are going to have just one session today, and I'm sure you would have lots of questions to ask. Though we are taking course 3, which talks about the group dynamics, but we thought we'll take a basic element, that is communication. Communication being essence of any group dynamics or any group formation or group continuing. So we thought let's discuss about what is communication and how effectively we can use communication interdepartmentally, interpersonal, intrapersonal, which is very significant because we are dealing with the patients, you are dealing with the team workers, you are dealing with relatives, the public. So that's the basic reason we thought how important it is for you as a nurse administrators to use the communication so very effectively that the patients are able to understand what they are going through and what kind of problems are there which they need to go and ask from the nursing personnel or the medical fraternity, or what kind of things they should be able to observe themselves. So keeping that in view, we thought we'll talk about the communication for the nurse administrators and significance of it in nursing situations. We have with us Ms. Kaura, who is the Chief Nursing Officer at St. Stephen Hospital, and she has been a nurse educator and is a nurse educator too. We are very pleased to have you, Ms. Kaura, with us, and I'm sure your experience will help us to know lots of practical examples where the students can really understand that which are those situations in which they have to use the effective communication or the communication which is understandable to the patients and to the relatives. Thank you very much for coming, and let's start. What would you like to talk about the concept of communication? What is communication?
Communication is basically the exchange of ideas and opinions, emotions. And when we say nursing care and communication, we do communicate with patients in many ways, and in everything we are exchanging the facts, exchanging the opinions, exchanging the ideas, and we try to understand the emotions of our patients.
Well, I think that's very important. That means it's just not having to deal with the ideas and opinions, but also the feelings of individual. It may be patient and maybe relative, and that's what I think is very important in the profession of nursing. Let's talk about, what are some of the, when we say communication is a process, what do we mean by it? How it is called as a process?
In communication, we are having two people, and in communication a person is sending the message. Right now what I am doing is I am sending the message. As students, many of you are sitting at different places, you are getting the message. So we can say that as a process, a person to send the message, and a message is there, and a person to receive the message. Once you receive the message, you are going through it, you are trying to understand it. Then you give the feedback, and once the feedback is sent to the person who is sending the message, the process continues.
I understand that there are two people, more than two people also sometimes when we are communicating. In nursing, though we know communication is very important, but how do you think a nurse needs to communicate with patients and relatives? If you can quote some of the examples, live examples from the situation, probably that will clarify more. What is the importance of this communication from the nursing point of view?
Nursing point of view, when we talk, the planning nursing care, when we are understanding the patient, understanding the need of the patient, then only we are able to plan the nursing care. To reassure a patient who is going for the surgery, for example, pre-operative preparation is one of the important factor what we need to remember. To prepare a patient pre-operatively, a nurse need to communicate with the patient. She may have to use verbal communication, she may have to use much more than that as the non-verbal communication. In non-verbal communication, a nurse need to be present with the patient. that is far more important than saying the things in words. And informing the condition of the patient to the relatives is another factor what we need to remember. Many a times when we are saying that, oh, less nurses or nurses are busy, we don't have time to be with the patient. But you spend 1 minute with your patient, you look at the face of the patient, listen to the patient and then respond. That will be giving much more satisfaction to you, and it will be giving more satisfaction to the patient. Yes, there is somebody to talk to me. There is somebody who is listening to me. And that will be sending the patient from the hospital with a feeling. Yes, if I go to that hospital, there is somebody who listens to me and there is somebody who is ready to help me at the time of need. Not only the patient, relatives also get the same feeling. And this type of interaction will be helping you to solve the problems. Many a times, solving the problem, you may think, oh, ये तो एक छोटा सा ही इंसिडेंट है या एक छोटा सा ही प्रॉब्लम है, पेशेंट अपने आप वो हैंडल करेगा या रिलेटिव्स अपने आप हैंडल करेगा. व्हाट हैपेंस इज व्हाट इज स्मॉल टू यू is a big problem or a big situation for your patient. It may be an IND or putting suture for a patient. For you it's a small thing, but for a patient it's a big thing. Many a times we nurses need to understand and realize the need of being with the patient and making the patient to understand it. At the time of preparing a patient for leaving the hospital, health education, and health education cannot be done without communicating with the patient.
Maybe that's where something is very important. And then you were talking about the relatives, how important it is because the nurse deals with the relatives also, and how we need to communicate the condition of the patient after the surgery, and even the patient comes in emergency ward. I think at night the patient is brought to emergency ward with pain in abdomen. There are so many questions which come in the relative's mind. Is it appendix? Is it appendicitis? It is a burst appendicitis, or is it something very serious? You know, so many questions are there, and as you very rightly said, because the nurse deals with the human beings, she needs to communicate with the relatives also. So what are the other importance of communication in nursing? Can we have the slide back, please?
When we say the nurses are dealing with human beings, we need to understand that say for example, we need to prepare a patient for ultrasound. Patient is to be prepared, patient need to be a willing person to undergo the investigation, and the relatives need to understand why such an investigation to be done for the patient, and that is not possible without explaining in detail what your patient is undergoing. You may see something and you may be wanting to investigate on what you are seeing for your patient. Until unless the patient is understanding why he or she needs to undergo that investigation, they will not be willing. Many a times the lab investigation, many people are scared of having blood extraction. Who can convince the patient? Only a nurse. And how a nurse can convince the patient? She needs to explain what she is going to do. Extraction of blood is a very simple procedure for many of the nurses, but it's a big procedure for the patients. And many times what most of the nurses do is they don't tell anything to the patient, they don't talk at all, but they take the syringe, they take the needle and they go to the patient's bedside. Outcome, patient will say, nahi nikalna blood. Many a times when they say that nahi nikalna hai, that is the time when you say ye jaruri hai, and what are the things what you are expecting that particular specimen to undergo various investigations. And if you are ready to explain that simple thing to the patient, and if the patient is understanding that based on the investigation only the treatment will be, then it will be much better for getting the cooperation of the patient. Other than that, when we say for making a patient to take the medication. Very often what we see is patient, say for example your patient is a small child. A mother who is staying with the child will be undergoing lot of tension. She will be having lot of questions to ask. When you are trying to give the medicine to the child, you are saying, oh, this child is not taking the medicine. But at the same time, you are admitting that you are not ready to communicate with the child. The problem comes as your problem because you are not ready to communicate with the child, you are not ready to communicate with the mother. So communicating with the relatives and convincing the relatives and convincing the patient is equally important.
I think that's very significant. Well, how do you think it holds an importance with the colleagues and seniors?
In the colleagues and seniors, when we say, as a nurse deals with other workers. Say for example, if you are a staff nurse, you are dealing with your ward in charge, your supervisors, and you are dealing with your own category of people. They may be same as you in seniority, they may be junior to you, they may be freshers. In all category, you need to communicate to a senior, respectfully conveying the message, taking up the orders, taking up the directions from a senior is equally important. To your co-worker, talking to her in a friendly manner will be making her to accept you as a person and you as a co-worker. To a junior, you will be becoming as a guide. You have to coordinate the work, you have to guide the junior. Say for example, a new graduate is coming to your ward. You are the person who is there to tell that new graduate what is to be done, how it is to be done, why it is to be done, and then only the person will be able to understand. In a ward when you work, you have other workers like housekeeping staff, the helpers, all those people are working with you, and you need to understand that until unless they get the correct direction, they will not be able to continue with the work what they are expected to do.
And that's very significant, whether it is colleagues, seniors or subordinates. That makes lot of sense for a nurse to make the communication effective, keeping in mind that whichever level a nurse is communicating, it has to be the respect, the regards, the protocol needs to be maintained, even though the patient is there or some other members of the society is there. So, because you know that the nurse deals with public, and this is what is very significant. Let's talk some of the communication which takes place in administration, in the hospital administration, in community administration or in nursing administration. What kind of communication takes place?
In nursing administration or in a hospital administration, first is horizontal communication. You communicate with the people of your own category or your own level. A ward sister communicates with another ward sister. A supervisor communicates with another supervisor. A staff nurse communicates with another staff nurse. Downward communication. A supervisor gives the direction to a staff nurse who is working with her. A senior staff nurse gives direction to a junior staff nurse who is working with her. It could be upward communication also. That is, when an incident is happening in the ward, a junior nurse may be the person who is there. She reports to the senior or she reports to the ward in charge, and then the ward in charge reports to the supervisor. That is the upward communication. Other than this, in the hospital, we do have face-to-face communication with each individuals, which could be called as grapevine communication. That is, in every area you will see that other than the official formal communication, to some extent informal communication is also necessary.
Well, those were some of the methods Madam Kora was trying to explain about the communication network, and also she was saying that there can be a horizontal communication or vertical communication depending upon the type of situation. Recruitment process is one way by which we have the communication in the administration. Would you like to explain how do we communicate there?
The interview process.
Yeah.
The interview process, when we say the recruitment process, is one time when we come across with a new person, we are seeing her, and the way in which she is able to transmit the message from her to others is taken into consideration. You as a supervisor or an administrator, you are asking her the questions, and she is trying to explain the things, or she tries to tell you what are the things what she knows. And then in recruitment process, you are able to tell the person what are the things what she knows. In administration, other than that, many a times we do assess the new appointee by knowing what she is communicating with you.
Well, that's about the recruitment. What are the other ways by which the communication takes place in administration?
In administration, the orientation which is given to a newly appointed or a new graduate who is coming to your department, that is, a person who is new to the institution will not be knowing the protocols what are to be followed in that particular institution. That person will not be knowing what is expected from her or him. To make it very clear to them, giving orientation to a newly appointed person on the first day of joining is important. It's an ongoing process, and it takes a lot of time and effort, but making the people to understand on the first day some of the essential things what they need to know about the institutional protocol is important. Other than that, the personal evaluation, the face-to-face communication is important in this. In face-to-face or in the personal evaluation, the communicator or administrator is communicating with one individual. Knowing the name of the individual is important. Calling a nurse as a staff nurse or student nurse makes sure that your communication will not go forward. Whereas if you know the name of the person, the communication will be a successful communication. Other than that, the group communication, say for example, you are calling few nurses of one particular unit and having a meeting with them. That is group evaluation or group communication. In service education, you are conducting classes, you are teaching them what you are wanting them to know, because they are the staff who are going to work with you. Bringing them up to your expectation is your responsibility. Other than that, decision making is always possible only if you are having good communication. If you are not having good communication, then the cooperation what you get from other workers, your own team members, will be varied. And add to this, we can say that coordinating the work, if you are wanting to coordinate the work of your unit, then you need to get the cooperation from other workers of your unit, and that is possible only if you are a good communicator.
Yeah, I think these are some of the important aspects which we thought we could discuss. Now, you were talking about communication in patient care, and you used one word as planning care. That when we are planning the care, we need to communicate with patient, we need to communicate with the relatives, we need to develop that kind of a care where the patient is participatory. So would you like to elaborate that what are the other aspects, like you were telling, reassuring the relatives, what are the other aspects when we are taking care of a patient, a nurse needs to communicate effectively?
A nurse needs to tell the patient what is to be done and what the patient needs to, like when a patient is coming to the hospital, we say that patient needs to get the orientation within the hospital. And getting the orientation within the hospital
Slightly.
is one way of making the patient to know that patient is being cared for. And many a times reassuring the patient and solving the problems of the patient is important. Very at times,
Yes, I think reassuring the patient and relatives is important because it's patient is on the bed. He or she is being taken care by the relative, by the medical team, by the nursing team. But the relatives staying outside are very anxious, and that really troubles them. So then in between, the nurse needs to come and tell the patient's relatives that things are being done. Just relax for some time. Am I right, Ms. Kaura?
more than that, when a patient is coming to the hospital, fear of unknown is
Yes.
one major factor what patient and the relatives undergo. And if you are able to remove that fear of unknown, especially if you are working in a casualty or in the emergency unit, you will know that a patient is coming maybe with high fever or maybe with severe pain, or patient might have met with an accident, or it could be anything. No matter with what the patient is coming, patient and the relative, all of them go through fear of unknown. Fear of unknown place, unknown people, then what diagnosis they are going to make. Whereas, when we are there as caretakers, when we are there as nurses who are there to answer for all the questions of the patient and the relatives, then we are making them comfortable. At the same time, we are answering to their queries. Making a person to understand that, look, I am here to take care of you. That message will comfort the patient to a maximum extent. Providing the maximum health care possible is our responsibility. And once the patient knows that, well, all my pain I am going through, but I am in a safe place where people are ready to take care of me. When the relatives are there, many a times when you walk around, you will see many relatives standing outside the wards, outside the emergency unit, even outside the hospital. What everybody wants to know, I can give you one very good example. During the dengue outbreak last time, wards were full, many relatives were there. But during the visiting time, all the relatives were wanting to know only one thing: how much is my patient's platelet count? Everybody invariably wanted to know. It could be patient A or XYZ. Everybody had one question only: how much is my patient's platelet count? And just giving them the correct answer about their patient's platelet count was comforting them. What action you are going to take for my patient's low platelet count? Well, we are doing this for the patient. They are comforted. Patient is comforted and the relatives are comforted. The fear what comes in the mind of a person when he or she enters in the hospital is very huge. And when a person is undergoing that fear, it is our duty as nurses to remove that fear, no matter what is the cause of the fear in them. And when we are informing the condition of the relatives, say for example, your patient may be in the ICU. ICU word itself gives rise to lot of fear for the relative. Intensive care unit, all the equipments, all the measures what each one of the ICU patients undergo, that gives lot of fear to the relatives. What happens? A relative who is waiting outside will be undergoing lot of fear, lot of tension. क्या पता मेरा मरीज के साथ क्या हो रहा है? What improvement they are making? Whether they are going to come out of ICU? All these are the questions what they go through when a relative is in the ICU. And to make them understand what is happening, we need to sit with the relatives and explain to the relatives time to time. It may be 3 times a day, it may be 4 times a day, calling the relative, making them to sit and then explaining the condition of the patient to the relative is important.
Well, these are some of the things which you had been talking in terms of patient care and relatives care. Let's be very specific about what are the purposes of communication. What are we trying to achieve by communicating? You had been telling past 10 minutes that the patients, the relatives, the team members, everybody in the hospital, we need to have a different kind of communication. What are the specific objectives we want to achieve through good communication?
The purposes of communication, when we say communication is for providing information.
Okay.
Say for example, you are a senior nurse or you are the supervisor. You are expecting your team workers to carry out one particular task. And until unless you give them the direction, until unless you are giving them the correct information, they will not be able to carry out the work what you are wanting them to do. It could be for maintaining the cleanliness, maintaining the equipments in order, or it could be for connected with the patient care. Then, to maintain a good teamwork, to maintain a good group work, that is, each member need to feel that they are wanted in the group. How can a leader achieve it? That is possible only by good communication. If a leader knows that all the members are aware about what is happening within the group and what is expected from the group, then their way of handling the things, their way of seeing the things will be different. If you are not understanding what is to be done or what is happening with other members of the group, you will not be able to carry out the task as you are expected to. Then, a team leader need to motivate the members. That is, when you are a team member and if you are doing a good job, you always want your supervisor or your seniors to tell you one word of appreciation. Appreciation always motivates the members. Without appreciation, no one will be able to do a good job. And getting the cooperation from the group members is possible only if you are taking them along with you. To take them along with you, you need to motivate them and you need to convey the message to them. When you know that as a worker, as a team member, you are doing the good work, you get job satisfaction and you get work satisfaction. And many a times when the leader is wanting to take a decision, she may contact you, she may come back to you.
I think these are very specific one, that how when you are communicating, how many things you are able to achieve and how it helps you as an individual to be satisfied in your nursing job and also to be satisfied, oh, today I am satisfied the work which I have done for my patients. Because the communication, as Ms. Kora pointed out, is not only verbal, there is a non-verbal communication also. If you've just gone and touched the patient, you know, your warmth which is passed on from your hand to the patient's head has communicated a lot to the patient, and that's where we need to that's where we get the satisfaction. And one has to remember these kind of small little things when we take care of the patient. You were saying that we have a sender, like you were saying that you are giving the messages. At the moment you are communicating with the students, a group of students who are sitting all over the country, and they are receiving. But what are the other elements of communication? If you can explain, what are the different elements of communication?
In communication, one person or the communicator is sending the message. So that person is called as the sender. And the message what we are sending is encoded, and there need to be a specific message which is to be understood by the students. Then the media by which we are sending the message, that is again important. The receiver, we can call that person as decoder, and once the person or once the receiver understands what is conveyed, then the receiver is sending back a message that is called as the feedback.
Well, so this is also was mentioned by Barlow as SMCR, source, message, channel and receiver. So the source, as Ms. Kora said, encodes the messages, but there has to be a way the message will be understood by the patient and by the relatives if it is encoded in the language which is understood by the decoder or by the patient. I often feel worried when it is written that patient should take the medicine QID. Now this is very difficult for the relatives to decode it, and I met a very good surgeon in a hospital. He has devised a very nice mechanism. He makes the round for 4 times a medicine. So I think these are the ways by which we need to communicate. The encoding should be done in a way by the messenger so that it can be decoded easily by the receiver. And the channel which should be used also should be understood. For example, if it is a written kind of a thing, one may not be able to read. So you have to use a proper, 5 channels are there, that is auditory, speech, touch and all that. Those channels can be used. But I think this is very important that in a hospital situation, sometimes, as you very rightly said, that we take things for granted that it is understood. It may be small for us because we are doing it day in and day out, but it is very big for the patient even to come to know that the platelet count is going low. What do you mean by that? The patient will ask, patient's relatives may ask that. So what next you are going to do? What next you are going to do? Because they do not know. And you say we will do whatever is right for the patient, but no, that right is to be explained to the relative, and I think that's where it is very important. So let's talk, we were talking about that there is a sender and there are channels. So what are the different modes of communication?
The verbal and non-verbal, we say, is the 2 modes. In non-verbal, when we say, we are not using any words. The written communication is one method which is widely used. Then face-to-face communication, that is, you are looking at one person or one-to-one communication, we can call it as, because we are looking at the person and talking to the person and we are listening from the person. Non-verbal communication is another method what we use, and when we say going and remaining with the patient at the bedside of the patient is an example of non-verbal communication. Telephonic communication, very often you call another person to find out how he or she is doing the particular task or how she is getting on. Then communication through internet. Nowadays communication through internet is high in use. Then the media communications are also much in use.
Okay, so these are the modes of communication. We can say verbal and non-verbal, and that's what you classified the various kind of communication. When we are talking about mix of this in the hospital, what are the usual methods you use in the hospital for communication?
In the hospital, if you are talking about the patient care, modes of communication are mainly verbal and non-verbal. Verbal, example, you are going and asking the patient how the patient is feeling. Non-verbal, you are going and remaining with the patient and you are touching the patient, you are holding one particular area or looking at one particular area. That's an example of non-verbal communication in patient care. But in administration, when you say, you can say use of notice board. You are wanting to give one message to many members at the same time. You are putting it as a notice and putting it on the notice board. Suppose this could be used in a particular department. Suppose the message to be given to much larger group within the hospital. You are making it into a matter is made into a notice and circulated to all the areas, or it is formed into a newsletter or house magazine and circulated among all the members within the hospital and outside the hospital. Another mode of communication is we are conducting meetings. Larger conferences can be organized, or a small group meetings can be organized, by which you can communicate with the members verbally and non-verbally. And departmental letters. In-house departmental letters are used basically for communicating or conveying the message to one particular department. Use of email is also possible. But out of all this, the best thing is face-to-face communication. And when, as an administrator, when you are talking to one particular individual or group of individual, that is more effective than sending the notices or sending the circulars.
Well, these are the easy ways now to have the conferences and video conferences and teleconferences and communicating on the email, and I think this makes the care of the patient very important. For example, if you just email to the people or just announce it in the hospital that we are going to have a disaster, the patients are coming and there has to be a disaster management team ready, and everybody gets onto the task immediately and starts doing the work. So I think these are the very important ways of modes of communication in the hospital situation. What do you think? What kind of steps a nurse can take in planning the effective communication? What should be a priority in her or his mind while planning communication, whether it is patient or relative or any group of workers?
When we plan the communication, first step is we need to form specific objective.
Right.
Once you know what is your objective, it may be preparing a patient for successful surgery. Once you know the objective, your entire communication process will be aimed at particular objective what you are having. So before starting the communication, you need to know your objective. Then who all should be participating in your communication process? That is, if it is patient and you, to prepare a patient preoperatively, you may not be the only one who is going to take part. You may be having a team members, and other team members also need to know what are your objectives. And transmitting the message from you to the patient and to the relatives and other family members and friend circle is also equally important. Once you are wanting to communicate, you need to make sure that you are establishing mutual interest. Once you are able to establish mutual interest, then patient's participation or others' participation also will be becoming more. And you need to watch the timings. Timing is important because once you are going on talking about the same topic, the person loses interest. Short communications always catches the attention, and you need to find out what are the major results of your communication. You tell something to the patient or you tell something to your subordinates, and don't expect them to show the response immediately. Give them time. You may be able to see the outcome of your communication in a day or after few hours of time.
What do you think are advantages of verbal communication over the non-verbal? Because we have a verbal communication and we have non-verbal communication. What are the advantages?
One major advantage is it is faster.
Okay.
You talk to the person, it's much faster than sending a letter or sending a note.
Yes.
And it takes less input because you need not spend much time
In writing.
you can in writing or typing out the material, but you can talk to the person and it takes only less effort from the sender's side. And a person who is listening to your talk can respond to you easily, or that also can be fastened. And suppose, say for example, you are assisting in a resuscitation procedure. A doctor who is standing near you keep on telling you, sister, give injection soda bicarb, give injection atropine. Your action is much faster.
That's right.
So, early clarification, if you suppose doctor is telling, sister, injection soda bicarb, you may be wanting to know the amount. Immediately you are able to ask. So, these type of things are possible only in verbal communication, and that is not possible easily if it is non-verbal communication.
But what are some of the signs which can be emitted through the non-verbal communication, which you cannot do through the verbal communication?
Yeah, that is true. In the non-verbal communication, if you are very close, your communication will be more effective.
That's right.
But if you are very far, then your communication will not be all that effective.
Yes.
A person at a distance may be wanting to tell you something, and it could be words may not be clear, lot of noise may be there, or the person's speed of talking may be too fast or too slow, or the language what the person is using may not be very clear to you. And posture. When you are standing near a patient, you are leaning towards the patient, shows that you are trying to listen to the patient. Or in your office, while a nurse stands opposite to you and you are leaning towards your chair, leaning back towards the chair, that shows that you are least interested in what your nurse is saying. And physical appearance. Every time when you are presenting yourself in the right way, then only the communication process will be taking up effectively. And many a times, more than what you express, more than what you say is shown on your actions and shown on your face.
So, as you had very rightly pointed out, that in nursing we have a formal communication and we have informal communication. The formal communication can be upward or downward, as you said, or it can be horizontal. Interdepartmental it can be, or interdisciplinary it can be. Also, you said that you can have a grapevine where gossip is there, you convey the message and it gets passed on, and when you want to convey such a message, you give to a right person so that the message goes on. And then you said that there are meetings and news bulletin or email messages which comes as a formal grapevine communication, and informal is more of a personal contacts. I think it depends upon the type of communication which we want to have, whether it is to the group, or to the individual, or to the organization, or to the major group, mass communication. So the approaches can be used accordingly by the nursing persons. With this, I would like to thank you, Ms. Kaura, for being in studio with us and discussing, though a very simple topic, but this is a very basic for any nursing person, because we are dealing with the human beings, and human beings need to be communicated, whether it is verbal or non-verbal, and that's a biggest thrust of a profession where you are dealing with the human beings. Thank you very much for being with us today. I haven't got any attendance from any of the regional directors. We are coming back at 2:30 for the post-basic BSc nursing program. I would request the regional directors to kindly give us the attendance of the students who have attended the teleconferencing session for the DNA. Thank you. Please join us back at 2:30 for the post-basic BSc nursing program.